Right, good afternoon, everyone. Feels like only yesterday when we first launched and conducted our kickoff event for this webinar series. And now we're already on our second session. So welcome to this afternoon session on conducting evaluability assessments and crafting an evaluation agenda. So to formally start our session this afternoon, I'd like to call in Assistant Secretary Roderick Planta of the National Economic and Development Authority Investment Programming Group. Good afternoon, ASEC Planta. Please go ahead with your...
Maraming salamat. Good afternoon, everyone. On behalf of my principal, NEDA Secretary Kalchua, I would like to extend my warm greetings to all the attendees today. And also on behalf of the United Nations Development Program, UNDP, NEDA's institutional partner for this webinar series, I'd like to welcome our M&E partners and stakeholders for joining us this afternoon. Magandang hapon din po sa ating mga VIPs or VVIPs. Sinisilip ko po yung mga pangalan. Marami pong nandito sa aking nag-confirm po. But I saw our NEDA family, Regional Director RD Lim, Regional Director Sonido, also Director Gebela from Tariff Commission, Director Ramos Lacuna of PPP Center, mga friends po natin sa House saka sa Senado po. I only saw si Director Gamboa po muna dyan, and then I think marami pa pong darating. Pero maraming salamat po sa pagdalo. Sigurado pong ako sa palagay ko po, sigurado pong sulit ang hapon ninyo. Wala nga lang pong pamerienda. Pero at kung may nakalimutan man po akong binabating mga BBIPs natin, may libreng pamerienda po kayo bago po ako mag-retire sa gobyerno. We are here po for the second session of our M&E webinar series with the theme of New M&E, Strengthening Leadership for Development in the New Normal. And as we have promised, we will be having this monthly webinar series for the entire year to provide opportunities for enhancing knowledge, skills, and attitudes for executing tasks needed for M&E in the new normal. It often bears repeating that evaluation is a powerful tool for public accountability and governance, and evaluation findings improves the overall effectiveness of development efforts. But we all know that efforts to build and sustain effective evaluation systems face several challenges, including institutional setup or institutional design, political dynamics, perhaps technical skills, access to tools, and sometimes, I think, resistance to change. Still, we'd like to think that NEDA is your valued partner, and also in UNDP, in strengthening evaluation capacities for evidence-based decision-making. But more importantly, we are inspired that you are with us in this evaluation change process. And that is why the topic for today's session is very apt, interesting, and relevant for the challenges ahead. The presentation topic will be on conducting evaluability assessments and crafting an evaluation agenda, which will introduce to us the basic premises in prioritizing the initiatives or interventions to be evaluated. Our resource person from IDinsight, who will be properly introduced in a while, will at some point also be joined by our panel discussants, senior officials. Mamaya ko na rin sila ipapakilala ng mas tama po, from Department of Transportation, Department of Health, and Department of Agriculture. We certainly hope that the ensuing discussion will enable all of us participants to draw on the rich and innovative experiences of these agencies. I therefore wish everyone a productive, fruitful, and illuminating discussion ahead, and may this activity continue to inspire us to engender the evaluation culture in our own spheres of influence, And NEDA, for its part, would like to be a part to all these interesting evaluation journeys ahead of you. Maraming salamat po. Back to you, Adele.
Thank you, Asik Eric. Exciting indeed, ano? And what a way to sort of end the work week as we move towards the break, no, for the Holy Week. Um, right. So as in like the previous webinar session, we have a very straightforward session for this afternoon. We had our formal welcome by Asek Planta from the NEDA. You were able to take down the first part of your attendance earlier. And then after I'm able to acknowledge our institutional participants, we will immediately move into the presentation by our resource speaker, whom I will introduce at length, no, at better length in a short while. And it will be followed by a panel discussion, as mentioned by Asik Eric. We have representatives and officials from the Department of Transportation, Department of Health, and Department of Agriculture. And then we can invite the rest of our participants to webinar to participate in our moderated question and answer portion before moving on to the closing remarks. And that will formally end our session for this afternoon. Hopefully over and done by 4 o'clock. Moving on, I'd like to acknowledge all of the 34 agencies who have joined us for this afternoon. If I miss out on any of formally registered institutional partners or participants, please call my attention and type in the chat box. But I'd like to acknowledge the presence and the participation of officials and staff from the National Economic and Development Authority, the Bangsamoro Planning and Development Authority of the BARM, the Commission on Audit, the Commission on Population and Development, Department of Budget and Management, the Department of Agriculture, Department of Finance, Department of Foreign Affairs, Department of Health, the Department of Information and Communications Technology, Department of Labor and Employment, Department of National Defense, the Department of the Interior and Local Government, Department of Transportation, and the Department of Tourism. We also have representatives from the Development Bank of the Philippines, the Early Childhood Care and Development Council, the Governance Commission for GOCCs, the House of Representatives, as earlier acknowledged by Asek Planta. We have from the Local Water Utilities Administration, the National Commission on Indigenous Peoples, the Philippine Competition Commission, the Philippine Institute for Development Studies, Philippine National Volunteer Service Coordinating Agency, the Public-Private Partnership Center of the Philippines, the Presidential Management Staff, the Senate Economic Planning Office, Supreme Court of the Philippines, and the Tariff Commission. And we also have our partners from the Australian Embassy, the Innovations for Poverty Action, Japan International Cooperation Agency, and an NGO for the first time who comes all the way from Bohol, from the province of Bohol, and UNICEF. I hope I did not miss out on any one of our institutional participants. All in all, we're actually joined in by 34 organizations and about 214 participants in this call. What I'd like to do next is to walk you through very quickly our mechanics for question and answer later when we open the floor to entertain questions from everyone in the call. You can type in your questions in the Q&A box, which you will find at the bottom of your screens. You can ask one question and follow it up with one other clarificatory question, but only if necessary. And you may also indicate to whom you are addressing your questions. If everyone's ready to rock and roll for this afternoon, I'd like to introduce our resource speaker for our topic this afternoon. So Meg Battle is an associate director at IDinsight based in Manila, Philippines. Although at the moment, she's out of the country and in her home base. And thanks to her and her team, she's able to join us despite the huge time difference. As associate director for Southeast Asia, She supports the organization's strategy and growth in the Philippines and across the region or Southeast Asia, as I mentioned. Her regional projects include designing a monitoring system for the Philippine Department of Health, particularly the Universal Healthcare Delivery Pilot, some 2 evaluation projects of school-based hand-washing interventions with the UNICEF, and advisory engagements with proximity designs in Myanmar and GEON in Bangladesh. Meg also supports engagement with the impact investing community in Southeast Asia. Meg has a bachelor's degree in human development and international studies from the Boston College Lynch School of Education and an MPH or a Master's in Public Health from the Johns Hopkins Bloomberg School of Public Health, where she was a summer scholar. Friends, ladies and gentlemen, everyone in this webinar call, I'd like to turn over now our screen time and for her presentation, Ms. Meg Battle of IDinsight. Meg?
Hi, everyone. Hi, everyone. Thank you so much. It's a real pleasure to be here. And yeah, I'm just thrilled to get to share a little bit of our work with IDinsight and the various departments, as well as UNDP and NEDA. So I will just go ahead and share my screen. Just give me one moment, please. Okay, I'll assume that you can see unless I hear you tell me something else. So first, again, I just want to thank UNDP and NEDA for the invitation to share about our work today, and as well as thank our partners across the different departments who are here, who have been our partners over the last 9 months or so as we've worked on this evaluability assessments project with them. We have learned so much from them and just really enjoyed the engagement and been really inspired and motivated by the amount of engagement and commitment to evaluation and to research, especially through the pandemic. And I'm just thrilled to get to share some of our work today with all of you in the hopes that it will support, motivate, and spark some thoughts and ideas about how to bring evaluability assessments to the work across the Philippines government. So quickly today, I'm just going to really briefly tell you who I am and really who we are at IDinsight, share a bit of what we actually did with all of these departments over the last year with these evaluability assessments, share some synthesis of our observations and recommendations, and think about the way forward. So just very briefly, who are we at IDinsight? So we are a global NGO. We work with government partners, foundations, NGOs, really anyone in the development sector to help them generate and use evidence for decision making. What that means is that we use a lot of the classic tools of monitoring and evaluation, but we really start with the question, what do you need to know in order to make better decisions, rather than starting with, how can we do some interesting, cool research here? Our priority is very much around informing the best possible policy and programmatic decisions to maximize the social impact of the work that is done across government, across all development work. And so the 3 things that really characterize our approach is that we bring rigor, we bring like academic level rigor to the work that we do. And so we help our partners think, in the most rigorous way possible about what questions they have and how they can answer them. Timeliness. We know that especially in government, you need to make decisions on certain timelines. And sometimes those timelines don't align with, the best possible or the longest possible study. And so we want to start with your questions as government policymakers, and then work backwards from there about what's the most rigorous research that we could bring to bear. And we're also demand driven. And so this is another way that it quite distinguishes our work and that we think is so important, especially thinking about evaluability assessments and evaluation agendas, is to say, research questions and priorities should come from the people who are going to be making decisions and who need that evidence, instead of from the researchers in this case. And so we really work with our partners, especially in government, to help them uncover what are the most important questions that they have, and then how can we build research based on that. So IDinsight works across sectors. We consider ourselves measurement experts and across the world. And that's why we're really excited to work with UNDP, NEDA, and the various departments on this project, because we were able to bring to bear this perspective on how to use evaluation in agriculture, transportation, trade and industry, and health. And I think our approach and the lessons that we learned should hopefully be widely applicable to all the different representatives and all the different departments that are here today. So let me give you a brief overview of the engagement that we've been talking about, just so that you understand kind of what our experience was. I'm not going to spend a ton of time today on the specifics of the engagement, the nitty gritty, because I actually think that that'll be really more interesting to hear from the departments themselves and from our panelists later on, although I'm happy to answer questions if people have them about the specifics of how we went about this engagement and what we actually did. So we worked with 4 departments, as we mentioned: DA, DTI, DOH, and DOTR. And with each of those departments, we were helping them work within the NEPF, the National Evaluation Policy Framework, with NEDA and DBM, which has been created by NEDA and DBM, and really thinking with each of these departments, how do they plan for their evaluation needs over the next several years? And so our objectives of this about 9-month engagement was first to create what we called a learning and evaluation roadmap. So those roadmaps encompassed their evaluation plans for the next 5 years to guide strategic, operational, and budgeting decisions. And I'll go into a little bit more in the next slide about what we exactly mean by a roadmap. And the second was to build capacity. So we were selecting stakeholders from each department, as well as through NEDA, to drive, to build their knowledge and skills to drive these roadmaps forward. So that doesn't mean necessarily that each department then left with economists on their team who were able to conduct a randomized control trial, or data scientists or data engineers who are ready to build a monitoring system. But what it means is that we were looking to build the capacity to identify evidence needs and bring in the right partners, and then interpret evidence to drive important policy decisions forward over the course of this engagement. So why create a learning and evaluation roadmap? I know there's so many terms being thrown around with the NEPF. There's the evaluability assessments, there's the evaluation agendas, and now we're adding one more. And so we want to make the case for why this is so important and why this can be very useful. So it starts with being able to plan for resources for monitoring and evaluation. We hear all the time from our government partners, we want to evaluate our programs, we want to monitor them more closely, but we don't have it in the budget. And having a document that says, here's our plan, here are our priorities, this is where we're going to devote resources, and this is why, it really helps make the case for actually devoting real budgets to that. It helps for showing the process that you went through, that it's not just, oh, we want money for evaluations for everything, but these are the ones that we landed on, and here's why. It then helps execute those monitoring and evaluation activities. So the learning and evaluation roadmaps that we created, and that we hope that other departments may go on to create themselves, will include a plan for, this is actually the timeline, this is the budget that's included, here are the people that you will need, here's a general sampling methodology, here's the research questions that you could use. And so having that roadmap, having that design set out ahead of time can be really useful for actually implementing. It certainly doesn't go to the level of day-to-day planning for carrying out any monitoring and evaluation activity, but it gives that high-level guidance as a starting point for moving forward. So you're not starting from scratch when you say, we know we want to evaluate this program. Okay, we've got some money for it, but now what are our research questions? What's our sampling approach? How are we going to do this? The roadmap should already contain that information. Should also generate evidence then to inform policy and programmatic decisions for the departments. So once you carry out monitoring and evaluation, I know from working in NGOs before I came to IDinsight, and I assume that many of you have had similar experiences, where you run an evaluation, you carry out a monitoring activity, and then the data just kind of sits there. Right? You're not actually using it and feeding it into your strategic decisions, your operational decisions, because maybe the timeline of the evaluation wasn't lined up with when you need to make those decisions, or the questions that it answers are really interesting and like food for thought, but don't necessarily feed right into the decisions you need to make. And so thinking about evaluation needs and evidence needs big picture before you start and putting it down in a roadmap can actually give you the chance so that when the evaluation is done, you know exactly how it will feed into the future decisions that you need to make. And then also improving operations and strategy with new evidence. So, you know, taking what you learn and actually translating it back and saying, we found that this delivery mechanism for this particular service works better in person than digitally. Or we found that it's actually much more cost effective to deliver this program digitally. So we're going to go that way instead. And so just directly improving operations with the evidence that you generated. And then finally, this brings us back around to identifying new evidence needs. So once you start looking for gaps in evidence and you start thinking about how to improve your monitoring and evaluation approach through the lens of evidence needs and not just documentation or accountability from the programs, you're going to start seeing these needs everywhere. And it's exciting. It can also be overwhelming because you start to want to evaluate and monitor all of your different programs in a really rigorous way. But that kind of closes the loop and brings us back to planning for future evaluations. So this was kind of the theory and the rationale behind why we created learning and evaluation roadmaps with these 4 departments to, support their work moving forward. So I wanted to show exactly what the NEPF lays out and then how we interpreted that and drove it forward with these departments. So the UNDP Evaluability Assessments drawing from the NEPF called for coaching and mentoring on evaluation planning. And so what we did at IDinsight with the different departments was program prioritization. And so we had the departments list out many, many different programs, different projects, they all have their different terminology. So I think these different pieces will resonate with different participants here today. And we generated these long lists of all the different programs. And then we said, here's our ideas, drawing from the NEPF and our work as researchers on how you could prioritize these and say which ones are most important to evaluate and which ones are maybe less important. So for example, a really small program that's been running for 20 years, that's quite beloved, that probably won't, be really changing much in the future, but really doesn't take a lot of resources. We would probably rank that as like a low priority for evaluation because it's not likely to change. There aren't any major pending decisions coming up about it. And there's probably not a lot of political will to drive, any changes forward, depending on what you learn in the evaluation. Versus a new program that has massive potential for scale, that has really high potential impact, but is small right now, and we don't quite know how it's running. And we'd like to see, is it running well? Should we scale it? And in this case, I'm thinking particularly of telemedicine, which is, a program that's been launched and really focused on during COVID by DOH. And so we helped design an evaluation strategy for telemedicine to see, how it would move forward. And so that's a very obvious one to be prioritized. And so what we did with these departments was to take them through this prioritization exercise and ask the different stakeholders in the department to rank each program across a series of criteria and then decide as a group which ones are the ones we want to focus on for this activity. The next one is assessment of a results framework. And so a results framework can take many different forms. I'm sure many of you have worked with log frames before, logical frameworks. Others have probably worked with theories of change. In IDinsight, we have a strong bias towards a theory of change, although a results framework, a log frame can be really useful in certain settings. But for each program, we developed a theory of change because it allows for a level of complexity and it helps us think beyond what's an activity, what's an output, what's an outcome, where we can get really stuck in that language. And even for us as evaluation experts, we can sometimes be confused. Is this a secondary outcome or a tertiary? And for us, we're like, it actually doesn't matter as much. So what we want is to capture the complexity and the hypothesized way, how do we think this program works? And we took the departments through that in order to eventually be able to assess, are the chains along the way actually valid, and to measure those as we go. And then the third is to developing an evaluability assessment report. And so that's what kind of fed into our learning and evaluation roadmaps. So an evaluability assessment is not just a yes or no, is this program evaluable right now? What it actually is thinking about what is the right tool to assess this program as it currently exists, right? Is this program in need of a robust, rigorous impact evaluation over several years, measuring whether or not it's achieving the outcomes that it intends to compared to, a control group? Are we just trying to understand, is this program being implemented as intended right now? In which case, maybe what we need is a really strong monitoring program, monitoring system, or a robust process evaluation that will help us understand implementation, operations, and then could potentially eventually feed into an impact evaluation in the future. So this is the process that we went through at a really high level, and what characterized our approach. So as we're thinking about evaluability, there are several different factors that come into play. And I've mentioned some of them already, but I want to just go through them a bit more. The first one is department staff structure and internal capacity. So it's really, really crucial to think about, what resources exist within each department, and are they able to carry out this evaluation that we are recommending and that we'd like to carry out. And this can talk about, is there a distinct monitoring and evaluation team that serves the M&E needs for programs across the whole department? Are program staff expected to design, carry out, commission, oversee, and interpret the results of M&E for their own programs? What level of expertise do we have internally in the departments? So there's a lot of questions that come into play for this type of question, for this factor. And this can vary a lot, obviously, from department to department, and from program to program or project to project within the departments. The next one is the nature and the scale of the programs. So you heard me mention before that, a really small program that's been going forever, that's maybe just in one, small area, might not be the most important program to evaluate when we're thinking about the prioritization. But scale can go in a few different ways, right? And so sometimes we think that it's, really, really important to evaluate programs when they're at a small scale if the pending decision is about taking it to a larger scale. So again, telemedicine is a great example here, where right now it's at a relatively small scale. And I think DOH is sitting with this question of how much resources and how much attention to devote to scaling up telemedicine, to reaching more people with it and making it, a more institutionalized approach. That's a really big question when we think about evaluability. And then current data collection and management systems and methodologies. So there are times when IDinsight will be approached to conduct an impact evaluation, and a partner will come to us and say, we've been running this program for 10 years. We're so excited. We want to do an impact evaluation. It's time. And we'll say, cool, can we see your monitoring data? Can we look at how the implementation is going? Can we see how it's grown over time? And sometimes, those partners come back and they have really robust data to show us, yes, we really can prove that our theory of change, at least early on, is happening as we expect it. And what that means is that, for example, if you're running, an adult education program, like your trainers are well trained, you can see that their test scores about how to train improve before and after they are, they go through the initial training, that adults in the community are coming to the education sessions, and that their education actually improves from before and after they participate in the system. And so then we want to go and see, okay, are these adults who participated in the trainings, is that actually changing their behavior or their outcomes afterwards? And that's where like an impact evaluation would be the right time for it. But in some cases, programs are quite young, they're quite new, or they're really complex. And they just don't have the right data management and data collection systems already. And so the most important thing often in those cases is to invest upfront in other data collection and management systems before we invest in a really robust impact evaluation to measure the final outcomes. We also look closely at the existing results framework. So we want to understand, what do we actually think is happening here? Is everyone who's working on this program aligned about what we're aiming for? What are the primary objectives of this program? Are we aligned in the pathway of how we get there? Do we all agree on what are the most important key components of this program or policy? And we've got to make sure that we're all aligned on that before we start measuring things, because we might want to measure different things between different people on the team. And I'll tell you, I personally have worked on probably 15 or 20 different theories of change or results frameworks with different partners in government, NGOs, foundations over the last several years. And I've never, ever worked on one where we get all the different stakeholders in the room and everyone is fully aligned on what the results framework should look like or exactly how the theory of change works. And that's because it's dynamic. It's, your interpretation as a stakeholder of how things work will inherently be different. And it's so valuable to invest that time and energy in getting it right, so that you can then make sure that you're all aligned about what to measure and how to evaluate the program. And then availability of resources is, of course, crucial. So, we could talk all day and design the largest, most robust evaluations for every one of the programs or policies that we discussed with the different departments and all of your departments as well. But the reality is there's limited resources. It wouldn't make sense, nor would we advise to carry out, massive evaluations of every single policy or program. And your teams, even if you could find the money, just having the human resources to, oversee those evaluations, to interpret the results, to turn the results into action would be a real challenge. And so, we really advise being very thoughtful and going through that prioritization process in a very practical way to say, okay, we know we probably only have the budget to evaluate, 3 or 4 programs in a really robust way in the next 2 years. So which ones are going to be the ones that are going to allow us to meet our, objectives for our evaluation agenda? So thinking a little bit more practically about exactly what we did with each department as we went through this process. As I mentioned, we went through the program prioritization for a few weeks. Then for each of the selected programs, we selected 2 programs for each department. We did a theory of change development. Then we went through an evaluability assessment process. And then we consolidated all of that into the learning and evaluation roadmap. So for each roadmap, it included 2 monitoring or evaluation designs, as well as reflections on our recommendations for the department overall and their M&E strategy moving forward. And then we also prepared what we call the conclusion report, which consolidated our observations and recommendations from this entire engagement. And I'm going to share a little bit more of that later today. What did we learn working with all these different departments? Okay, so the synthesis here. So we found several different challenges, and we have corresponding recommendations based on the work that we did with the departments. And so the first one is just limited monitoring and evaluation capacity in each department. And our corresponding recommendation is to invest in monitoring systems at the programmatic level and in building capacity and expertise of internal staff. So just to talk about the challenge first, everyone that we worked with, we at IDinsight work with partners across the board, across the world. And so my work really focuses in Southeast Asia, but I have colleagues who work in countries all over the world. And, everyone is so eager to work with our government partners, but we know that governments around the world really face major challenges in building their capacity for M&E. One thing that I really love, though, is that, working so closely with government partners in the Philippines, I am just so struck by how excited and committed and open to learning the staff are within, all of the various departments and oversight agencies that we interact with, and just the desire to bring strong data and evidence to bear in our work. And still, like, there just needs to be more. So I just want to be really clear that we're not talking about individuals not being committed or, having the knowledge or expertise, but we just need even more of you all who are, passionate and committed to this work to drive it forward. I do want to go back though in this recommendation, because it's not just building the capacity and the expertise, it's also investing in the basic monitoring systems. And so this might seem a little counterintuitive. Our M&E capacity is limited. Why are we investing in monitoring systems and not just getting more people? And the reason is because monitoring systems actually allow us to kind of like automate the collection of high quality data and consolidate that in a more automatic way. And so once strong monitoring systems are in place, it actually takes the burden off of M&E staff and having to go out and help design and conduct basic monitoring activities for every new program or policy, and it becomes something that's just built in, so that M&E staff can focus on one-off evaluations rather than needing to build comparable systems for all new policies and programs as they're rolled out. The other challenge, which I'm sure will be no surprise to any of you, is just limited financial resources for evaluations. And so we are, recommended to oversight agencies to provide more guidance on departments' M&E structure and funding sources for evaluation. So we know from, talking to many of our partners in the departments that they're saying, we know we want to carry out these evaluations. We think we can ask some of our development partners, but we're not sure. It's challenging to figure out, exactly how to build that into our timelines. We budget on an annual basis. We don't know exactly who to ask for, every specific evaluation. And it's hard to figure out how to check all the boxes to drive this forward. And so we think there's a really valuable role that oversight agencies could continue to play as they promote the NEPF, in also supporting like the really nitty gritty practical question of how do we get money for this, and what's the right way to build this into the budget and make sure that it's not cannibalized in favor of other, very urgent priorities. But that, often M&E is the first thing to be cut when there's new financial needs. So what we also are hearing is that, departments are feeling or maybe suspecting that there's an expectation that they would conduct evaluations for all of their programs. And instead, we'd highly recommend prioritizing certain programs for evaluation and setting others aside. Ideally, those others are having, strong monitoring systems that are running. And so we still know generally what's happening for each of those programs. But it's just not practical to run a robust evaluation, whether it's an impact evaluation or a process evaluation of every program every year. It's probably not even possible to do that for every program every 5 years. And so the prioritization is really crucial. And the criteria, there's some criteria laid out in the NEPF already, and we really encourage departments to customize those criteria based on their own needs and their own priorities, but to just be really clear about, we're going to invest in a few really strong evaluations rather than trying to do like smaller or maybe less rigorous job for like many more evaluations. And then finally, you've heard me talk already about results frameworks quite a bit, but there, in some cases, we were seeing a lack of clear results frameworks and then understanding of evidence needs. So what that meant is that, sometimes when we would be talking with our partners in the departments, their opinions or ideas about where research should go and what they really needed to know, that maybe wasn't a question that they were having or a discussion that they were having before we joined. And so we really encourage departments, as they're thinking about planning for their evaluations, to develop results and decision value frameworks for every program. So a decision value framework, I'm going to just spend a little bit of time talking about what that is. We would say that for every evaluation that's carried out, there should be, a decision that's defined, like what will we do with this evaluation? If we find that this program is working extremely well, does that mean that we can, one, generate more funds for it? We can ask for, more funds to scale it up. Two, we could test new approaches and see if we could find an even more cost-effective way of delivering this program. Three, we could expand the target population for this program. So that would be, one decision value. The other could be, we're seeing that enrollment in this program is consistently low, and we're having to like force people to join it rather than seeing, overwhelming demand. So maybe we're going to do an evaluation, and the question is, should we continue to provide this this program at all? And if not, are we going to, design something different to meet the same needs? Or are we going to kind of start from scratch and go and maybe do a needs assessment in the communities that we're trying to support and figure out what do they actually need, and maybe we can, start over. So a decision value framework creates a way of thinking about how you will use the results right from the beginning, so that when the results come, it's not such a surprise and, oh, we have no idea what to do with this. You've kind of already thought about that up front. So now we just want to share a few thoughts on a way forward and how to strengthen M&E in the Philippines. And so, we've talked about the department staff structure and internal capacity, and just investing in staff and capacity building for M&E teams. So, this means continuing to build up the size of teams and the expertise that are on each team. The nature and scale of programs is prioritizing evaluations in an evaluation agenda. Then centralizing and strengthening monitoring systems. So I didn't mention the centralization as much before, but I think that is such a crucial piece, where if we have one data system that can serve many programs that can potentially feed into and be interoperable with each other, it makes everyone's lives easier, both at a central level for overseeing and having dashboards and interpreting data as it comes in, as well as for researchers trying to understand the relationship between programs, and staff who are switching potentially between different programs and not needing to learn a whole new system. And then developing theories of change to guide monitoring and evaluation plans. And then finally, thinking about budgeting additional or new financial resources for evaluations. And that's thinking about, who are the right funders, the right potential sources of funding there. How do we budget for multi-year evaluations when we know that the budget cycle is annual right now? And how do we protect those funds to keep them focused for M&E, even when there's other urgent and important needs that come up? So I will pause there. I'm very happy to answer questions, to hear feedback and reactions to what I shared today. And again, just want to thank UNDP and NEDA for inviting us here, as well as so many of my colleagues in IDinsight. Actually, most of our team is on leave for Holy Week this week, so you're just getting me, but I'm supported by a really wonderful team that supported this work across the board. So I'll pause for questions or feedback.
Thank you very much, Meg. And again, thank you for indulging us at this time of the day. I know it's very late where you are. Perhaps a few minutes more, so that after the panel discussion, we can open up for some questions from our participants. But with everybody's indulgence, I'd like to immediately jump into the next part of our program, which is our panel discussion. And let me just share my screen so that you have a sense of who the members of the panel are. And I'd like to introduce them one by one. So the first member of our panel is Maria Sheila Gabukayan Napalang, who is currently the Assistant Secretary for Planning and Project Development in the Department of Transportation, where she is on secondment. She is an associate professor at the UP School of Urban and Regional Planning and was the director of the UP National Center for Transportation Studies from July 2016 to July 2019. Dr. Napalang obtained her BS Civil Engineering from Xavier University Ateneo de Cagayan, MS in Civil Engineering, major in Transportation from the Virginia Polytechnic Institute and State University, and her Doctor of Engineering degree, major in Infrastructure Economics from the Tokyo Institute of Technology. She's a licensed civil engineer and environment planner. The second member of our panel is Dr. Socorro Santos, who is the OIC Planning Division Chief of the Health Policy Development and Planning Bureau of the Department of Health in the Philippines. She graduated Doctor of Medicine in 2011 from the University of the Philippines. She also finished her Master's in Development Economics from the same university. She has experience in sectoral planning, budget development, health sector monitoring, policy development, and evaluation of different public health programs in the Philippines. The last member of our panel is Mr. Don Bertis, who is a licensed environmental planner and currently works as Project Evaluation Officer in the Planning and Monitoring Service, Monitoring and Evaluation Division of the Department of Agriculture. He graduated with a degree in management from the University of the Philippines in the Visayas. He has completed his coursework for his Master of Arts in Urban and Regional Planning from the University of the Philippines School of Urban and Regional Planning. And Meg, thank you again for that presentation where you were able to perfectly meld together both the concepts as well as the practical experience of the project. And I'm sure the biggest question in everyone's minds right now is that, is this something that's doable in government? Or is this something that our agencies can take upon and embrace ourselves? So it's important to talk about it from the actual experience of the agencies that we have with us here in the panel. And I'd like to begin by asking, Asik Sheila, how would you describe DOTR's practice of and system for monitoring and evaluation results? You have big ticket projects over at the DOTR.
Waddle, you're putting me on the spot. Anyway, first of all, I'd like to greet everybody a good afternoon and thank you for inviting us over. And before I answer your question, Waddle, I'd also like to thank UNDP, NEDA, and particularly IDinsight because they've been really patient in guiding us through the process. In the department, we were very happy to be involved in it because it is a long-term goal of the department to actually do evaluation. Okay, to answer your question, Waddle, how do we do evaluation? And this is something that we've discussed with IDinsight in the beginning of the engagement. And we said, right now, we are focused on what we call process or implementation evaluation. It's really like project monitoring, right? You look at whether the projects are implemented based on the design. So we look at cost, time, as well as quality, right? So that's where we are right now. We have the project monitoring and evaluation group, the PMAS, as well as the project monitoring offices. They do the evaluation, which is just looking at implementation. All right. So the big ticket projects are right now just to make sure that they're on time and they follow the quality design. That's what we do. Okay. So because you asked me about what we do right now, I'll just talk about our aspiration later on. I will not preempt your question, but right now we're really at the project monitoring level where we are.
Thank you, Asik Sheila. And I think that kind of practice is prevalent among many agencies, mainly because of how it's being tracked and reported. So input and activity level, and whether or not they are according to budget and the specification of the timeline. I'll move on to Doc Soki. Health is an important commitment in the Philippine Development Plan. How do you track the DOH progress, and how do you report your contribution to meeting PDP targets and commitments?
Yes. So tracking our progress in the PDP is very important for the DOH. So when we selected indicators for the Philippine Development Plan, we chose those that are most meaningful and those which we are sure that have regularly reported data, even if not annually, especially since for health, most data for outcomes comes from surveys. So in the PDP results matrix, you can see how often the data is expected to be available. And we also aligned our monitoring and evaluation frameworks with the PDP. So the Formula One Plus, which is our current medium-term health sector agenda, is aligned to the PDP, and we monitor the same indicators to make the process more efficient.
Thank you, Doc Soki. I'm actually a little familiar with DOH effort to actually streamline, no, all the indicators that they report on and track insofar as universal healthcare is concerned. And there are so many data that they're looking into and tracking. And it's important to be able to actually streamline and identify the key indicators that should be monitored and reported, and which are directly aligned to the agency's commitment insofar as the Philippine Development Plan is concerned. And I'm sure it was quite a challenging exercise. Speaking of challenges, I'll move on to Don. Don, was it an easy thing to do to be able to track the agriculture sector? What were challenges that you had to like manage with and overcome in order to be able to track and especially evaluate results? I mean, like agriculture is likewise a very important commitment on the part of government.
Hi, good afternoon, everyone. So with regard to the challenges that DA encountered in tracking and reporting PDP targets and commitments, for one, the periodic monitoring and consolidation of accomplishment reports are still done manually. So DA is quite a big department with more or less 50 offices, including national program management offices, and our office, the monitoring and evaluation division, with a limited human resource capacity, coordinating with these offices and processing and consolidating the reports manually is really a challenge. Also, uh, tracking and monitoring PDP targets and commitments really entails interagency and multi-sectoral coordination. Another thing is the scale of the intervention, since majority of our commitments in the PDP are national and large in scale. And lastly, some indicators that we committed in the PDP are quite complex and really requires rigorous and elaborate designs and methodologies for data collection and analysis. For example, in the agriculture sector, we have technology adoption among farmers and fisher folk, the level of mechanization, reduction in post-harvest losses, and the rate of borrowing of farmers and fisher folk from formal credit windows. I mean, these indicators require a separate evaluation study on its own. And because of this, accomplishment of some indicators will actually be reported end of plan. So those are some of the challenges we are encountering.
Oh, thank you, Don. I'm sure a lot of our participants here on this call will greatly relate with the kind of examples and challenges that you're talking about. From what all our members of the panel have shared so far, the kind of evaluation and monitoring system that they have in place relate mainly to limitations in terms of tracking, monitoring inputs, and even timeline. So it's not even talking about results just yet. Although on the part of DOH, there's already an effort to streamline all of the indicators so that these indicators adequately capture the kind of results that they want to track and report on. And on the part of DA, are the limitations imposed by the current system insofar as the availability of or access to technology that will facilitate the gathering of data and information. However, in Meg's presentation earlier, there were a lot of new concepts that the engagement probably has introduced to you, new big words, no? That the engagement talked about. So what I'd like to ask the members of our panel next is that from out of your work with IDinsight, what were immediate or even top of mind realizations and opportunities for change and learning that you picked up from that experience? Anong bago? So there were new concepts, big words, new ways of working and tracking results. But right off the bat, what were immediate realizations that your agencies, respective agencies, came to terms with? Anybody?
I'll go first,
Yes.
Waddle.
Okay.
Yes. For the DOH, as far as our team is concerned, we realize how important the evaluation roadmaps are. So we already worked with IDinsight in the theory of change and with for the UHC. We are familiar with that, but again, the process is very tedious, and if you can see all the maps and the questions that are so complex, and we have to go through each concept and question one by one, and it really takes time, but we appreciate the process. And as Meg mentioned, the rigor of their techniques is really important for us to develop a good evaluation plan. I appreciated the part where we prioritized and assessed whether programs are evaluable. Of course, it would be a waste of resources to evaluate something that is not ripe for evaluation or may not be needed yet, and a missed opportunity if those resources can be instead channeled into a program that should be evaluated at that time. Another realization is although the DOH is very, I think, well established in terms of monitoring. We have um, many monitoring systems, in fact, which are at the moment are fragmented. So we hope to streamline them because we have 50 programs, and each program separately manages their own monitoring system, and evaluations are not systematically conducted. So through the evaluation roadmaps, I think it will be a model for other programs to replicate so that they will be able to plan ahead and think through what should be evaluated and allocate adequate funds for evaluations. Yeah.
Oh, great insights you have there, Doc Soki. May I turn over to Asak Sheila if they have their own share of realizations and aha moments as well while they were working with
Well,
ID,
even okay, just being chosen as one of the agency to be part of the ID Insight study was already an aha moment for us. Why? Because the department is actually moving towards okay. Because the reason why I wanted to emphasize that right now we're doing project monitoring is the fact that we are mindful how important earlier evaluations are, right? So formative evaluation, meaning evaluations that are done even before project implementation, that's very important. And then again, another one is the impact evaluation. That's why we're very excited, because if we're able to look at, okay, for instance, we have a feasibility study for this, and so in the feasibility study you have identified the benefits, and then so therefore if you do benefit quantification post project, right? Then you're able to feed that into the project development cycle. That's really where our interest lies, so that it feeds into the project development cycle. So you don't repeat a project that's non-responsive. However, you can improve the design of the project because you have a robust monitoring and evaluation system. In fact, in the reorganization, in the organizational chart which we submitted to the DBM, we actually included a project development and monitoring section, because we are, it's more than whether the project is implemented properly, it's on time and did not go any budget. It's more than that. For us, what's important is whether the project actually achieved the benefits that it's supposed to be built. And therefore, that's going to be important as you move into the next cycle for project development. So that's an aha moment. That's why we liked the theory of change, right? The staffers like, oh, it's so difficult, but they liked it. Why do they like it? Because they were able to articulate, right? Inputs, outputs, what you need to get into, and what the outputs and outcomes should be. So you see the project beyond the project itself. You see the project from the perspective of how, because that's what transport does. It should help it should help build livable communities. That's what transport does, right? So therefore, you should be able to see whether the projects will be able to feed into this vision of livable communities. That's the second one. The third one is uh, because of the exercise, we realize just how lacking data is, right? Because we wanted, like when we were prioritizing which project to actually be used as a case study, we had to make sure that the projects were not too old. Okay, not too old that the feasibility studies cannot be found anymore, because then you don't have data. Right. So that actually was an important aha moment for us. That's why in the subsequent discussion on the reorganization, we included like a knowledge management unit for us, where we would be able to put together, like for instance, you have feasibility studies, what were the benefits that were identified here, so you can use that moving forward. Yes. And the fourth aha moment for us is we took it took us a while, sorry, this I'd like to thank IDinsight. They were really patient when they were talking about research questions, right? Research questions on moving forward with the evaluation. Why is that important for us? Because we talked about this, they helped us focus on what needs to be measured, right? Sometimes when we don't do this properly, we just count what we can measure. But see, when we go through the process that IDinsight led us through, we now count what needs to be measured. That was an entire, that was a entire lesson of the, having this monitoring system, because you need to understand what you need to measure, not just measure what you can see. I think that's four aha moments for us already. Thank you.
Thank you, Asik Sheila. Meg, you have value for money here. I mean, like for this intervention and engagement, four aha moments from DOTR alone. But I'm sure that's not the last of it. I'll ask Don first for some realizations of the work coming out of the work that they had with you.
Yes, undergoing the entire learning and evaluation roadmap development process introduced by IDinsight during the engagement really exposed us to a more systematic and objective approach of developing an evaluation agenda and designing evaluation. For example, in the first stage, which is program prioritization, having limited resources for the conduct of evaluation activities, it is very important to have a comprehensive and well-defined set of prioritization criteria that gives premium to the highest priority evidence generation needs of the agency. And considering DA has a lot of programs that are nationwide and are large in scale, this will really help us prioritize impact evaluations only for the most strategic programs. Second, moving on to the development of theories of change. Although we are already familiar with DOCs prior to the engagement, we actually rarely use this as we are more accustomed to logical and results frameworks. The TOC workshops gave us a new perspective and strategy on how to effectively map out the causal pathways, especially that both programs selected for the engagement are very complex. And it is also important to note that during the TOC workshops, the loopholes and the weak points in the current program designs are already identified, and some were even addressed immediately. And by using the sound TOC as a foundation, assumptions that are most critical and least certain were identified and translated into research questions, then were matched with an appropriate evaluation methodology and design. We are also grateful that aside from the LNE roadmap itself, other very helpful and useful outputs of the engagement are also incorporated. For example, the output included recommended compositions of evaluation teams and indicative roles, sample size estimations, the indicative budget were already identified there. And aside from being systematic and objective, The good thing about the entire process is it can be easily adopted, replicated, and adjusted, and it allows for flexibility to adjust evaluation priorities and approaches as decision needs and timeline shift, or as new information becomes available. Last point, all activities relative to the project were conducted virtually. So this also gave us valuable experience on how to develop quality evaluation roadmaps and undertake M&D activities under the new normal.
That's a great reflection, though. So it's not a deterrent. It's a challenge that needs to be overcome, but it can be done. I think that's the main message that I'm getting from you right now. I'm mindful that we're at that Holy Week period in the country and elsewhere in the world. So, like they always say, reflections and realizations are hollow if no reparation is done. Like, so, even if we go through the motion of commemorating the lessons of Holy Week, if we're not applying it after, or there's no change that's being done. So realizations and reflections are just mere rituals out of the Holy Week. So my question to our panel right now is that, given these realizations from out of this engagement or work that you had with IDinsight, what are new ways, new systems or practices, or even behaviors that you're trying to introduce in your respective agency, so that you're able to make M&E or evaluation a little more rigorous, a little more robust, as well as linking it to higher order results? I mean, it's not just about having activities implemented or projects implemented anymore and according to timeline, but tying it up neatly and very closely to the kind of results that are desired by your agency, as well as in the Philippine Development Plan, like people's health and well-being, livable communities for the DOTR, productive agriculture insofar as DA is concerned. These are the higher order results. And in order for you to move towards that, what are the incremental steps, small steps, systems, ways, activities, behaviors that are you're trying to slowly change at the moment? That was a mouthful. I'm sorry. I'm sure you got the question. Don, we'd like to start with you first, please.
In line with the NEPF and in support of government efforts to institutionalize good governance, transparency, accountability, and evidence-based decision-making in the public sector, we are working towards the full transition to RBME. So we want to fully harness the agency's M&E systems and capacities to ensure not only the quality and timeliness of the delivery of our services, but also measure outcomes and impacts of DA interventions. So for one, recently there is a major shift from planning mainly focused on outputs to planning for results. But there is still a need for us to assist. There's still a lot of hand-holding to be done to assist every program in developing a results and decision value framework, which we learned from IDinsight. And as we only have limited staff, we actually are targeting to assist at least 5 priority programs of the DA within the year. And we also now prioritizes both physical and financial accomplishments in assessments and workshops, as compared to a time when the management is mainly focused on assessing financial accomplishments, as the budget of the department for the succeeding year is computed based on the absorptive capacity. So for this purpose, last year, we introduced dashboards where the operating units can easily check their physical and financial performance. We also intensified department-wide capacity building on RBME to ensure that our regional counterparts and our partners in our bureaus and attached agencies are capable and competent to carry out M&D activities and improve our overall capability in measuring and evaluating results. We are also working closely with other M&D units within the department and our information and communication technology service to link the various databases in the department in order to avoid duplications of efforts in the encoding of accomplishments, and be able to use and report one data or information for DA programs and projects. And lastly, DA is also leading the updating of the registry system for basic sectors in agriculture, or the RSBSA, and currently developing the Farmers Intervention Monitoring System. That will be the central database of DA. So these digital solutions are all included in the agriculture digitalization roadmap, which promotes transparency and governance and delivery of services. Thank you.
Oh wow! I mean, from a short and quick engagement, these are big changes that are already taking place. I'm impressed, and hopefully you're able to roll out all of these initiatives completely. But I'm sure there are gustong ibida ni na Asek Sheila at Doc Soki, some interventions and innovations that are happening at DOTR and DOH as well. Asek?
Ipapauna ko sana si Doc Soki kasi baka marami pa siyang ibibida sorry. I was gonna ask Dr. Soki to go ahead, Meg, because she might have a lot of things, but all right. Wow, Don, I was blown away by what you said as an outcome of the IDinsight engagement. So for us, I've mentioned this already. In the department, we already already have the PMS, the Project Monitoring and Evaluation section, which consolidates the progress of all the projects from the PMO, right? So we have quarterly reports, so we do have that, but we are also, the pandemic has given us a chance to also shift to online, where your project managers can also just update their project status online. Are we there yet? Not yet. Okay. We're still shifting to that, but we are consolidating it, right? But ours is not such big leaps. But I also mentioned that all these are, the putting up of a project monitoring section is already part of the reorganizational program of the department, right? Putting people who would be looking at this project monitoring, not just the implementation, but from the formative evaluation until impact evaluation. But what we have done right after the IDinsight is I asked the staff if we could have um, like we could document what were written as benefits in the feasibility studies that were conducted, because most of our projects, because these are big ticket projects, will have to go through a feasibility study, goes through NEDA, right? So most of these projects will have identified benefits, right? So we've asked the staff to put this together as a database. For me, that's very important, because we're so focused on, okay, project completed, but then what's next? So we wanted to just look at it, and for each sector to do a quick evaluation whether the benefits have been implemented. That's in the short term, because eventually this becomes more systematic, because we would have a knowledge management unit eventually. We are also actually upgrading, because after IDinsight, we were very inspired to also give training. I always say younger staff, but we have a lot of staff. When you're 50 years old, everybody else is younger. But anyway, all our younger staff, and I'm even saying 50 years old. No, I'm 55 years old. But if you're 55 years old, everybody else is young. So, but we wanted to make sure that those who are involved in project development would have an understanding. This is very important. Would have an understanding that the project is not just a physical undertaking, right? So that's where we're going. It's not a physical undertaking. It is more than that. So Meg was saying, okay, sometimes we get confused about outputs and outcomes. Yeah, we do get confused about that. So I like confusing our staff. So I make them look at outputs and outcomes, because outcomes are very important, right? For the transport projects. Because like, for instance, you can have roads, but that's just an output. You can have public transport services, that's just an output. But then again, do they carry enough people? Do they carry enough goods for logistics? So that's where we are right now. So we are also doing a lot of capacity building. But again, in the short term, in the medium term, we would like to pursue the reorganization, which makes this monitoring more formal. In the report that was prepared by IDinsight for the department, one of the recommendation, of course, if we wish to undertake an evaluation, is to have an external evaluator, right? Because capacity as it is not enough. But I'm grateful that with it's good to have an external evaluator, but it's also good to have your people understand what's going on. Because if you don't, your consultants will just tell you something and you just nod your head and you don't understand anything. So even when we will get external evaluators for projects that we deem are priority, I think what's important to us as well is for the staff of the department to be competent and have enough knowledge to to understand and eventually to undertake project monitoring and evaluation. So that's it for us.
Thank you, Asik Sheila. Although I think if I may also refer back to Meg's presentation earlier, that was one of the major insights as well as a recommended course of action to build capacity on the part of internal staff to be able to undertake the work. Although you shouldn't actually belittle yourself. What you've shared so far are major steps. I mean, like having a database of benefits already reorients the thinking of moving beyond inputs and outputs to thinking of results insofar as outcomes are concerned. Doc Soki, from your end, what are some new ways, systems, or practices that are being introduced or thought of in the department?
So the engagement with ID Insight is it comes along with our current initiatives on enhancing monitoring and evaluation in the department. So it's also in line with the like DBM's reforms on public financial management, such as the PREXI. And if you look at our Formula One Plus, one of the pillars there is performance accountability. So we highly value monitoring and monitoring performance, particularly in this administration. We have introduced new processes for monitoring, such as developing monitoring systems that are computerized. So our information technology service has been very busy lately, particularly with our response to COVID and linking individual performance to the agency's goals through the performance governance system. And with our major reform, the Universal Healthcare Act, and strengthening the health system in light of the pandemic. So M&E is really very important. So from our engagement with ID Insight, I think one of the most valuable um, like reforms that we can get from there is adopting the learning and evaluation roadmaps. So we have an annual research agenda which has been in place for around maybe 7 years already, 5 years, 7 years. But in the next year, we will be engaging multi-year contracting arrangements. So there we plan to integrate the studies or researches that are part of the learning and evaluation roadmaps, particularly for primary care monitoring and evaluation that is a product of our engagement with ID Insight. And we will also strengthen our capacity for evaluation. So we have already been starting to look into how to develop M&E in the agency, but I think the tools that ID Insight introduced in this project can be adopted, particularly, as I said earlier, the prioritization and evaluability assessments. Thank you.
Thank you, Doc Soki. Listening to the reflections and the insights of our panel, Meg, what are your takeaways? I see you've been smiling every so often while you were listening to them. What what do you take away from their sharing this afternoon?
It's really nice to hear just how effective the work was and how well it was received. I think hearing from the different representatives talking about each of their departments, it reinforces something that we think about a lot at IDinsight, which is how to build capacity. And we often say like sending people to a one-off training can be valuable and there's a place for that, but learning by doing is actually much more valuable. And so sending someone to a one-day session on conducting an evaluability assessment, like that's fine. And sometimes you need to do that and it's a place to start. But you're not going to know how to do this until you do it on your own program and you're actually accountable for the results at the end. And you're actually digging in and thinking about, well, actually, how is this going to work with my team? And I have to navigate the politics and I have to navigate the practicalities. And so it's not just a theoretical exercise, you're actually hoping that you're going to carry it out. And so, that is typically how we approach capacity building. And it's great to hear how internalized so many of the things that we worked on have been by the departments. I think because they really like rolled up their sleeves and were working on their own programs and not just in some hypothetical way. And then just the other piece that I'll share, back for other departments is I think in general, like capacity building and learning from these engagements is you get out of what you put into it. Like all of these panelists here today and their teams spent tremendous amounts of time and energy and thought on this process. This was not a quick thing for them to do. And in the midst of a pandemic and so many other priorities, they said measurement and planning for evaluation is a priority for us, and we're going to put real resources behind that. And it shows in the results and in how they're able to drive that forward already. And we were really grateful to partner with such enthusiastic and willing partners. And I think it really makes it a valuable investment for everyone. Yeah.
Thank you, Meg. To our panel, this is my last question already. And then after this, we can take a quick break so that we can start entertaining questions from... I'm already seeing a lot of questions on the chat box as well as on the Q&A box that we have here at the bottom of the screen. We'll try to go through all of them. But as a last question in this part of our discussion, I'm sure the biggest question in the minds of our participants right now is that, how do we begin to do this? How do we begin to like having a roadmap in our own agencies? And so I think one input or reflection that they can probably pick up from you is, what's the single biggest change that they need to like start doing now so that they can move towards having a roadmap and mainstreaming a results-based monitoring and evaluation agenda in their respective agencies, so that at the end of the day, everyone is able to account for and track their individual progress on their commitments to the Philippine Development Plan. What's an immediate action step that agencies can or should do? I mean, it doesn't need to be big, but what's an immediate small step that they can do either by themselves or with assistance from partners, or learning from your experience? Yes, Asik Sheila, you were first to
Let me
unmute.
let me go. It's like a game show. The first one to unmute can answer first, and then she can go on a break. That's why I wanted to go first. Anyways, what's see? I forgot my answer already. Your question was, what's
Single
your
biggest
first step?
that they
For me,
can
it's a changing of the paradigm. What is that? Earlier I keep saying this, that you look at the project, you don't look at the physical project. See, for me, it helps when people start looking at projects as, if you were to look at it, it's what is its goal, right? So then you know exactly what to ask, what questions you need to ask, what data you need to ask, right? So for me, basic is really looking at the project not as a physical intervention, but rather a societal, sorry, it's so highfalutin, but that's how I see it, no? When you start looking at the project, not as a something to monitor, whether it's over budget, over time, if it's quality, if we go beyond that, right? If we go beyond that, I think we will improve the way we look at monitoring and evaluation. Like I'll give you an example. Okay, why is it that it's important for us, the Public Utility Vehicle Modernization Program? Why is that important? See, when you talk about motor vehicle, sorry, the PUVMP, people automatically think, it's Jeepney Modernization Program. Wrong. It's more than that. It's actually a project that seeks to improve the public transportation system so that commuters will have a more efficient, a more inclusive, and barrier-free transport. So for me, that's how it is. You look at the bigger picture, and I think that's what you do in the theory of change. And even in the log frame, you always start with, okay, what is it that I want to change? So the long and short of it is we have to start by changing our mindset. Look at projects not as physical interventions, but rather as a societal contribution to making people's lives better, be it in health, be it in agriculture, or be it in transportation.
Thank you, Asek. You're not successfully hiding your professor hat there. It's showing up. Okay. And Doc Soki, your thoughts and advice to our participants as well.
Oh, the easiest way for me, the first step, drop an email to Meg and ask for their help. Uh, I think IDinsight is really helpful in this, and we would not have been able to do it without their technical support because the tools, the processes, it's a key step. So developing a theory of change is not simple, and I think that's first commit, of course. Commit to developing an evaluation agenda. We all government agencies have their OPCRs for commitment, right? So put it there to develop an evaluation roadmap for this so and so project. I think that is one very important aspect that we value having evaluation studies done on certain projects. And then next is get the right tools, get help if needed, and then build capacity in the long term.
I'd like to pick up on one thing that you mentioned, Doc Soki. I mean, like translating the agenda into something that's measurable. Also, the OPCRF that you're mentioning right now, because it's commonly held that what does not get measured does not get reported, and the primary point of measure with government and offices and employees will be their OPCRF and IPCRF. And if it's there, it gets measured, it gets tracked, and therefore people will be compelled to actually do something about it and deliver. Don?
Um, they mentioned some of my answers already, so I'm just gonna share. Start by generating buy-in and solicit support from the top management and the implementing units themselves. Based on our experience, as an update, actually, the DA evaluation roadmaps that we developed with IDinsight for one of the programs, which is Kadiwa ni Adi and Kita, our flagship marketing and agribusiness program. The head of the program is really interested in the process evaluation activity recommended in the roadmap, and they are already proposing this activity in their 2022 budget proposal. And for the other project, which is our the LNE roadmap, developed will serve as a valuable input to the ongoing development of this fund impact monitoring system. And DA also had an exploratory meeting with a funding agency interested in supporting our priority programs for evaluation. And we also started using and applying the learnings gained, specifically the development of DOCs and preparing evaluation questions in one of the ODA projects that will be evaluated this year. And that's one strategy that we used during the engagement to make sure that we'll have their support during implementation phase. The implementing units and the top management were really involved every step in the engagement.
And which highlights a very important point, Don, which is buy-in, because nothing will happen to any reform initiative if it's not supported both by top officials as well as the implementers themselves. We're actually running 15 minutes ahead of schedule, which bodes well for us so that we have more time for questions and answers. But at this time, I'd like to recognize that it's not healthy to be staying in front of our screens for an extended period of time. And so we're taking a 10-minute health break. I'll be flashing a reminder on screen. And hopefully, soon as the video is done, we can also resume our session. Thank you very much, Asik Sheila, Doc Soki, and Don, as well as Meg, for your insights and reflections. And then perhaps we can dedicate the rest of our session to responding to some questions and comments from our participants. Thank you very much. See you later, everyone. Welcome back, everyone. Hope you were able to make a quick dash to the bathroom, get some water, coffee, or tea, or some refreshments. But we should be back on our desks right now for the remainder of our session. And I'd like to immediately jump into the questions that have been posted here on chat. Oh, I think this is I will address the questions already to specific members of our panel. Like this first one here, as Sheila, I think you'd be the best person, or even Dawn would have some insights on this. Any suggestions on how to conduct M&E on infrastructure projects, especially this time of the pandemic, under the new normal setup? As Sheila?
Oh, okay. I thought Don was thinking, so he was about to answer. Anyway, no. Uh, One thing that we have done under the pandemic condition is because the DOTR does not have regional offices. So what we did for for monitoring of infra projects is uh, we inked a memorandum of agreement with whatever, for instance, if it's PPA, if it's port projects, and and other line agencies who have regional presence. That's one way of doing it, right? Thus the other way of doing it, and actually we're now exploring it, because there are also areas where you even the regional offices cannot reach, particularly if these are local projects, no projects that are undertaken in cooperation with the local government unit. So actually yesterday we talked about how we can use like videos, right? If they will be asked to, because all projects, all infrastructure projects that we have plans, detailed plans, right? They've got technical plans. So we know exactly what to look for, and we will just ask. Well, this is just still in the um, beta testing test. Is that the right term for the young ones? It's really just something we talked about yesterday. So we can just take videos and of the projects, and particularly if these are projects that need to be signed off, like completion projects, because you need to already pay the, what do you call this, the contractors also. So two ways: by memorandum of agreement, as well as using technology to do it.
Thank you, Asik Sheila. Don, would you have anything to add to monitoring infrastructure projects under the new normal?
Yeah, majority for in the case of Department of Agriculture, majority of our infrastructure projects are farm to market roads, and actually this is already a practice even before the pandemic. But during this time, this technology has been very useful, and we really harnessed the full potential of this technology. For example, we are using unmanned aerial vehicles to validate the construction of FMR projects, drones, and satellite imaging.
Thank you, Don. And I think also that's been several years in the making, right? I mean, the use of geotagging for reporting on infrastructure projects has been like in the works with the DA for a few years now. In fact, DBM is also implementing geotagging for some big ticket projects. I think this is a question that's best directed to you, Meg. Would it help to have some common or centralized prioritization criteria across all agencies? Is there some kind of rule of thumb on allocating resources for the conduct of evaluation? I think that was one of the questions raised in our first session, like how much of the agency budget should be like allocated for monitoring and evaluation. Your thoughts on it as well?
Yeah, I will take just the first part of that question first, which is that for prioritization criteria, the NEPF actually include criteria right now for prioritization, and I think that's great. They're a really useful place to start. But I would also say it's really valuable for the departments to decide on their own, are these the right criteria for us? So as much ownership as can be taken by the various departments or teams that are using the criteria, I think the more they will feel that it's theirs and it's their product to drive forward. In terms of a rule of thumb, I wish I had a perfect answer to that, and I just don't. um, What I will say is actually to push the thinking on that. Sometimes we hear numbers thrown around like, oh, 10%, there should be 10% of the budget for M&E, or, there should be 5% or 20%, or we should spend this much money. And I think that is maybe putting the cart before the horse in a lot of cases. What I would encourage, departments to do and for people to think about is, what do we need to know, and how much money, what's the most cost-effective way that we could run studies to answer those questions? And so oftentimes when you're comparing the amount of money spent on a program to the evaluation costs, it can be a little confusing, and it can be actually kind of unhelpful, because we'd actually encourage a lot of evaluation to be done upfront. When a program is new, when it's small, when you're just testing things, that is the perfect time to put real resources against figuring out if you're doing it well and if it's actually achieving the outcomes that you want to achieve. I'm just going to turn my video off because I know my internet's a little funky, and I hope you can all still hear me. But
I think we're losing you a bit, Meg. Once you have better connection, we'll get back to you. But I'd like to bring it to the level of the agency, Doc Soki. I mean, like, health has a lot of programs. A lot of these programs are mature in themselves as well, and they have their own monitoring and evaluation system, especially for those that are foreign funded projects. Um, the DOH went through a process of identifying 21 key indicators that you'd like to report on. I'm sure from out of the many programs and projects that the department is implementing, there must have been like a thought process and a prioritization process that went through in order to arrive at the 21 key indicators. Would you like to talk about that experience in response to the question that was raised earlier in terms of a prioritization criteria or something like that?
Yes, I think it will boil down to what is the it's really up to the agency to determine what are the most important projects and the most important outcomes related to that project in terms of prioritizing what indicators to report. But in terms of evaluating, I think that's a different parang it's a different set of criteria, because for monitoring it's fairly what is most needed to be tracked, what is most important right now, what are the possible implementation problems that may arise, and what do you need to monitor to ensure that implementation is going as planned. But for evaluation, I think for DOH, as you said earlier, most of our interventions are fairly established. We base our interventions on um, international evidence. So in terms of evaluating their impact, um, I don't think we have really a great need to evaluate the, for example, immunization. Do we don't really expect to evaluate if immunization has an impact on improving outcomes. But for us, I think it's with ASIC Sheila, it's more of implementation where we're not being very successful. So we prioritize process evaluations, particularly for those big ticket programs, because if it's not implemented well, there's nothing to evaluate in terms of impact. So yeah.
Right, and that's an important thing that we're picking up from you, Doc Soki. So even as the NEPF actually prescribes some criteria or some form of guidelines as to how to prioritize, at the end of the day, also it's incumbent upon the agency to actually determine what's most important to them and what's their wherewithal as to what programs need to be evaluated, what information is available, and what can be linked to higher order outcomes and results. Here's a question, Asik Sheila, that's specifically directed to DOTR. How has M&E been used by the agency in enhancing design, standards, and implementation of road construction and rehabilitation? The context being there are a lot of instances, especially now in Mindanao and perhaps also across the country, where roads that are still in good condition are being rehabilitated, and ones that are already damaged 2 to 3 years after completion. So, I mean, for projects such as this, what are enhancements brought about by a more robust and effective M&E system?
Mm. First of all, roads and the construction of roads is really not it's not within the purview of the Department of Transportation. It's actually the Department of Public Works and Highways, just to be clear about that, right? But I know that there's somebody from the Department of Public Works and Highways, but they do have a program for maintenance. I'm not sure if it's called a HDM4. So they look at the conditions of the road. I'm answering from what I know of the PWH, right? They look at this is physical evaluation. They look at roughness coefficient, right? And so they input this into their program to see the prioritization of roads that need to be rehabilitated. In fact, they also have a program for like periodic maintenance and what is this? Para major repair. Okay. The other questions like roads that are rehabilitated, right, that are still in good condition, I think that answer is beyond the monitoring and evaluation purview. Because I cannot answer why, but there is a system that DPWH uses to prioritize which roads need to be rehabilitated first. That's as far as I know how the department uses it. But now, I will answer you from the perspective of the monitoring and evaluation of DOTR for the design of the projects. All right. Although monitoring and evaluation is not often like it's not yet formally in place for the department, but all projects of the department, particularly the projects that have huge impact, undergo a feasibility study, which looks at the need for the project, what intervention should be done there, and so somehow it's the formative. That's why I was mentioning earlier. It's a formative evaluation. It's not evaluation that we know when you have project implementation, but formative evaluation happens when you're still at the feasibility stage, when you want to find out if your intervention is the best intervention there is for addressing the problem that you have actually identified. So in that aspect, all projects that are in the pipeline or have been implemented undergo formative evaluation because they go through the feasibility study. And so the designs are such that it will be responsive to the problems that have been identified.
Thank you, Asik Sheila. For Meg, here's a question for you. So, Philip here is saying that TOC formulation is very important in evidence-based M&E. However, impact evaluations are equally difficult and takes time and might require a lot of resources. So with this in mind, is it more practical for agencies to instead enhance their internal capacity to conduct monitoring and performance and process evaluations rather than impact evaluations to be conducted by third-party entities in their evaluation roadmap?
Yeah, thanks. This is a really great question. I think this is right. I think that ideally, internally, the departments would have capacity to build theories of change for their departments, to help design and use strong monitoring systems to carry out process evaluations. But even those things, like I think there's external support can be really valuable. And impact evaluations in particular, it can be tricky to get it right. And if you're devoting that many resources and that much time to an impact evaluation, you're likely going to want like a robust team. So, we're certainly not the only people that do it, but just to give you a sense, when we do an impact evaluation for a program, it's usually at the very shortest, it's at least 6 months, and it can often be several years. And that could be a team of an associate from our team, a manager, an economist, or a public health expert, and some director time as well. So it's like a really robust team following that project over months or years. And so I think, there's a world in which maybe a team like that could exist within the departments, but realistically, it makes more sense to outsource that and to build the capacity for the types of services and work that you want to do on every program, like a theory of change and monitoring system within the department, but also to have really good people in the department who can write good TORs, which you all know is so important, who can assess technical proposals in a kind of open-minded, creative, and thoughtful way, and who can be a strong partner to your impact evaluators throughout the process and interpret their results well. So you don't have to be an economist, you don't have to be able to do all the analysis yourself to interpret the results well and to turn it into good policy. So I think that breakdown is quite practical and makes a lot of sense in what we would recommend as well.
Great, great, great. Here's a question for all members of our panel. How can civil society organizations participate in the evaluation process of the agencies? Or is there any opportunity for that matter? Or is it in the thinking of government to actually expand M&E to also involve institutions or groups like civil society organizations to be part of the practice or of the process? I'll go to Don first. I mean, because PRDP for one already has integrated some form of community monitoring in the in this particular project.
Yes, in fact, under the administration of Secretary Dar, we even formalized the process of accrediting CSOs, especially that the work that we do here in the Department of Agriculture entails a lot of coordination and support from CSOs. Actually, we have an agency under the department really tasked to establish intersectoral and consultative platforms for our CSOs, and that's the Philippine Council for Agriculture and Fisheries. And they have regional and municipal counterparts, and they can always tap to those agencies and organizations if they want to get involved in the evaluation or monitoring of agricultural programs and projects.
Health is technical and complex, Doc Soki. I mean, is there an opportunity for organizations outside of the formal health institutions to take part in monitoring and evaluation?
Yes. At present, we're actually collaborating with CSOs, particularly for M&E for tobacco. So we have the syntax, and a lot of CSOs are our partners to monitor and evaluate our accomplishments and performance in terms of syntax. And our current systems also involve coordination, consultation with CSOs, not only in M&E, but also even in our policy and budget development process. So there's always a room for CSOs to partner with the DOH.
Right. And there's only so much that government can actually do, and where civil society organizations can also help out with. And I mean, there's some independent mind to it, and there's third party validation that government can also maximize in terms of having CSO partnerships and participation in the monitoring and evaluation process. As Sheila, any opportunities with the DOTR?
Of all the well, not of all the agencies, because I'm sure DOH is going through its own test of fire right now. But the Department of Transportation, even before the COVID situation, has always been in the center of things. That's precisely because everyone is a commuter and would have an opinion on how things should be done in the transport sector. Having said that, therefore, the department has always cooperated with civil society organizations, particularly now when we're introducing active transports, a lot of them are involved. And we also welcome feedback mechanism. feedback from them. And so we get a lot of, letters from them. But there is a formal way of involving the CSOs, and it's called Citizens Report Card. A citizens report card was actually implemented, again, DPWH. I'm not from DPWH. The only reason I looked is because I saw this, and it's a very good practice. So people are actually able, based on the report card, they can rate whether, for instance, if the project actually was able to achieve what it's supposed to do, right? So if it's a road project, is is the travel time shorter now? So it's a citizens report card. It's a feedback mechanism that can be used in some of our projects. For instance, in the development stage of the public transport projects like the BRT, this is part of the conversation with the stakeholders, because what they want to do is, while the project is being implemented, to have like a citizens kiosks where they can get information and updates on how the project is going on, right? And we normally, well, at least for the Cebu BRT, when we were developing it, we would partner with universities, local universities, to help us. Because what's important when you also when you involve the CSOs in a formal manner, is you also get a social scientist, right? A social scientist is able to get the pulse of the people. Engineers are more really technical and all that. So part of it is really what we did was like have a formal, like a citizen center sort of, where people can come in, they can drop in, and they can ask, oh, so what's the progress already? So the long and short of it is, there's a lot of opportunities for involvement of the CSOs at the definition stage of the project, at the implementation stage of the project, and even when the project is now operating. So yes, the department has always been open to partnerships with CSOs.
Right. Here's a comment from NEDA saying that CSOs are also members of the Regional Project Monitoring Committees, which is the monitoring arm of the Regional Development Council. So it's actually part of the system already, and which agencies can, mobilize or take advantage of, depending perhaps on the type of projects or as well as capacity. And speaking of capacity, this was a key recommendation in your presentation, Meg. Here's a question here that asks about the definition of monitoring and evaluation capacity. Does it specifically refer to institutional capacity or people's competencies as well? And what factors are considered in determining institutional M&E capacity? From your experience also, I mean, here's an additional question. What Philippine government agencies have high M&E capacity? Putting you on the spot there.
Wow, really putting me on the spot here. So I think there's like many components to capacity and for M&E, and I will say, like, I know that NEDA and UNDP are doing a lot of thinking on this and are actually going to be pursuing more work on figuring out how to actually define and measure capacity for M&E in the next, like in 2021. So I think stay tuned for more updates on that. But from our side, I think what we think about from IDinsight's perspective is we typically break down projects into like specific tasks. And we actually had like the team members of all these departments and DTI go through spreadsheets that are like, maybe 100 lines long of all the different tasks. Do you know how to do this? Are you confident doing it? Do you have time to do this? Do you could you ask somebody else to do it? Like, what actually exists internally? So we're talking about very practical skills of actually carrying out monitoring and evaluation activities. So, I mean, the specific skills are one piece, and that's the competency piece. And then the capacity more broadly is like, how many people do you have and are there enough, right? If you're asking one team of 4 or 5 people to oversee all the evaluations and support all the M&E work and all of DOH, there's no way. It's impossible. And so, just thinking really practically about, what are the needs and how can you work with the folks that you have. I truly don't feel qualified to say, oh, this particular department has stronger M&E capacity than any other. I think what I will say, um, it's just consistently a pleasure to work with all of these departments and the other departments that we've worked with and see their commitment to for wherever their department is, and all of them, like some departments might have really strong people with really technical skills in one particular area, and then they have no one who has a background in this other area, or they have like really great general knowledge, but they don't have expertise in particular. So every department, has structured their teams differently, but I think their like willingness to learn and grow has been really striking to us, and I think especially as we hear challenges with building capacity in governments around the world, from our colleagues, and just seeing that like our partners in these departments are like sponges for anything that we can give. Yeah, that's very, very encouraging to us.
Thank you. This last point is actually not a question, but a sharing from the Commission on Audit, no, from Director Ida. She's saying that these developments will simplify and facilitate the value for money audits or performance audits that are being conducted by COA. These audits involve, among others, a validation if the project or program was economically and efficiently implemented and if expected outcomes were attained. Agency-conducted evaluations may address the dearth of outcome indicators, which has been a source of concern in the COA's audits. The auditee's project or program evaluation results will be valuable inputs in the COA's value for money or performance audit. And I think what I'm taking away from this point from Director Ida also is that the different pieces of the monitoring and evaluation puzzle come together to form one big picture. At the end of the day, these results are articulated in the Philippine Development Plan, and each aspect of the work of each agency and everyone else contributes to making this picture whole as well as integrated, and then feeding into each other's work. And on that note, I'd like to thank our members of the panel. Special thanks to Meg. It's 9:40 in the evening where she is, and she has actively engaged us in this discussion, sharing her insights, inputs, and experiences. Thank you, Meg, despite the late time of the day.
Thank you. It was such an honor to be here and so fun. I love being on a panel when everyone is just speaking naturally and casually and really sharing your real experiences. It's so fun. So thanks to all my fellow panelists for, sharing really honestly about your experiences, and for all the really great questions, and participants for joining today. So thanks so much.
Asik Sheila?
No, I'd like to really thank, well, first of all, I've already said this earlier, but I cannot, I'd like to repeat it. Thank you, UNDP, thank you, NEDA, and thank you, Meg, IDinsight. I keep saying that because if it were not for the patience of IDinsight, because there were times when we had to postpone our meetings and they would always accommodate us. And so because of that, it was really more like, it was not so much like work, we're strict about work, but it was more like mentoring. So they understood that, we had challenges with our time. When our bosses says we go to this meeting and I cannot attend a meeting which I booked myself. So thank you for this one. And I hope that this exercise would also be helpful to all of our agencies, because M&E is something that we ought to really look at to really implement. The policy is there, but we still have a hard time making it a reality in our agencies. So thank you all.
I think what we're learning from this afternoon, Asik Sheila, is that the mandate of the NEPF can actually be translated into actual work. I mean, the experience of the three agencies this afternoon clearly demonstrates that. Doc Soki?
I'd like to thank again Meg and IDinsight, and of course NEDA and UNDP for spearheading this government-wide reform in MNE. And I hope that all other government agencies can eventually be involved in this project. Thank you.
Thank you, Doc. Ingat kayo sa DOH. Stay safe and healthy. Don?
Yes, I'd like to thank UNDP and NEDA, of course, IDinsight, Meg, of course, Aya, Kim, and Mark, who were hands-on with DA, and it's really fun working with all of you. And thank you for having DA here in this forum and really give us an opportunity to share our M&D experience with all of you. And may we all continue the noble work of really making development work for people through M&D. Thank you.
Thank you. So we're actually not officially done yet. You will still need to post your the second half of your attendance. But for the formal closing remarks of our second webinar session this afternoon, I'd like to call in Miss Marian Valera-Co, UNDP RPM analyst, who incidentally will be our resource person for our next session.
Yes. So I next session because I'm the resource speaker. Thank you very much and good afternoon, everyone. First, I would like to thank our speakers, Meg, Asik Sheila, Doc Soki, Don, and I would also like to thank the following attendees for their participation. And I'm basing this on the list of registered participants, so apologies if I missed anyone. Thank you to RD Lim and RD Sonido from NEDA, Yusek Pascua and RD Sanchez from DBM, Director Pascasio, Director Tan, AD Santiago from OPPMS, Director Gebela and Director Ignacio from Tariff Commission, Director Gamboa and ED Bronce from HOR, ED Salazar and Director Pardales from CEPO, Director Garcia from DICT, Director Manalo, Director Ramos from CPBRD, and Director Ramos from PPP Center, and Director Aida from COA. So thank you very much. And our resident representative, Selva Ramachandran, sends his regrets for not being able to join us today. But on behalf of RR Selva, I would also like to thank you for devoting close to 3 hours of your time to our second webinar of the M&E Forum webinar series. We are pleased that you were able to join us today to learn from our panelists, where we covered the topics of evaluability assessments and evaluation agendas, which are key to developing and implementing responsive M&E systems. We heard from IDinsight about the persistent challenges to M&E and their recommendations for strengthening how we do M&E in the country. We know some of these already, and some of us experienced this state today, but still it was very eye-opening. We also heard from our representatives from DOTR, DOH, and DA about their aha moments, as well as on their respective experiences in building M&E systems within their agencies, including the challenges that they had to overcome, just that they're still facing, and the promising plans that they have to further institutionalize M&E in their work. We also learned about the importance of having learning and evaluation roadmaps to guide organizations on strategic, operational, and budgeting decisions to ensure that we maximize to the extent possible the results that we plan to and committed to deliver. We hope that the experiences shared today have also grounded the M&E concepts that we learn about into realistic expectations of the work needed to be done when implementing M&E reform in our respective agencies and organizations. As always, the conversation and the learning does not end here. The next webinars will be focusing on conducting and managing evaluations, and I heard that we have a very experienced speaker and communicating evaluation results. So many things to look forward to. I would also like to invite you again to join our M&E Community of Practice Facebook and LinkedIn groups. I've shared the link here in the chat box. I hope you can click it and join that as well. So no need to wait for next month to engage with fellow M&E practitioners and enthusiasts. You can do it daily. Share your thoughts and your questions related to M&E, and we would be happy to send you our insights and our resources. So I look forward again to seeing you online at next month's M&E Forum. Ingat po tayong lahat. Thank you.
Thank you, Miss Mai. Looking forward to hearing from you next month on our third webinar session. And that formally ends our session for today. But let me just very quickly also mention the topics that we have for the coming months. So as mentioned, we will have commissioning and managing evaluations for April. And Ms. Mahir will be one of our resource persons for that particular topic. You will notice that the sessions for March, April, and May have been bundled together. So no need to register again for April and May. Your registration for the session this March already serves your registration for the next two topics. So you will just be sent links to the Zoom webinar session for April and May. And so, um, as mentioned, we have the National Evaluation Portal. We have pages on Facebook and LinkedIn. For questions and suggestions, please send them to the email flashed on screen. And so for the second part of our attendance, I'm already sharing. I'm sharing the link here on the chat box so that everyone can now submit their selfies together with the title of the session and your main takeaways from this afternoon's webinar. Thank you, everyone. Have a safe and meaningful celebration of the Holy Week. And then we will see you again in April. Continue the conversations, the sharing of insights and experiences on our Facebook and LinkedIn pages. Have a good afternoon, everyone.
Bye-bye. Keep safe.